A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, welcome. Lovely to see you all. Thank you for joining us. And I'm really pleased to be able to welcome Dr. Devang Shah. Welcome, Devang. How are you?
Hi, Mary. Thank you. I am doing fine. You tell me, how are you?
I'm very good. Thank you. Very good. Now, you are living in Mumbai in India and you trained in India as a homeopath. Can you tell me a little bit about that before we delve into what you get up to as a homeopath?
So I did my BHMS formal studies, which is 4.5 years, which is as good as what a modern medicine doctor undergoes. The only difference in subjects while studying we have is that they have pharmacology as a subject, and we have materia medica as a homeopathic subject in terms of medicine. But all other subjects, right from anatomy, physiology, biochemistry, then PSM, forensic medicine, surgery, skin, ENT, all these things are the same books that we use in India. And both the modern medicine, what we call as the MBBS, is 4.5 years, followed by 1 year internship for us as well, and for the modern medicine.
So what you're saying is that in India, you can choose whether to be a mainstream doctor or a homeopathic doctor, and the training is the same. It's just the pharmacology that's different. And you then have your internship, presumably with homeopaths and in a homeopathic clinic.
Correct.
Perfect. Okay, so it's really quite intense there, isn't it? And I know that a lot of people in India already know about homeopathy. So can you just give me an example of how many of your patients, how many of your population, percentage-wise, will know about homeopathy and will have used homeopathy?
Oh, well, I don't know the exact number, but from what I feel and I come to know, there are certain states in India which, like for example, Calcutta, where people opt homeopathy as the first line of treatment. So there, 100% of people know homeopathy.
About it. Okay.
In fact, they also have home remedies and they come to the doctor after taking arnicas, calendulas, and belladonnas. So these people have to think beyond the arnicas and the belladonnas and the calcareas. And in certain parts of the remote India, they are absolutely unaware of homeopathy. So you can say that it could be around 50% people know. But the trend is that more and more people are getting to know about homeopathy because more good doctors are, kind of graduating from homeopathy. And if the doctors are good, then the reach is more. And if the reach is more, then the spread is more. That's how it is.
Okay, so I know that India has the highest number of homeopathic doctors in the world. So there are many of you treating many hundreds of thousands of patients every day. And so it's lovely to have your experience and expertise, and we're very pleased to have you on our Homeopathic 24/7 team because you come with so much experience and such good training. So I know that today you want to talk a little bit about musculoskeletal diseases. Tell me a little bit about what you are treating. Tell me what you're finding.
Well, my journey with these kind of diseases began when, my a very good friend of mine, he kind of graduated as an MBBS doctor, and then he went for his MD studies in orthopedics, and I went for my MD studies in organon. And he, being a very good friend of mine, kind of invited me to his hospital. He owns a hospital in a place which is Pune, which is 3 hours from Mumbai. And he said that there are certain diseases like, chronic back pains, osteoarthritis, or rheumatoid arthritis, where modern medicine really has no answer. So he asked me and proposed to me that you come and sit in my clinic maybe once a month, and I will refer you patients, and you try to help them with homeopathy. So that is how my journey with musculoskeletal problems actually began.
So you've had lots of experience in this area. And I know that back pain is such a terrible, terrible thing for a lot of people because, as you say, there's not an awful lot that can be done apart from surgery and painkillers. And that often doesn't make it better, does it?
True.
I have also heard that a lot of back pain is worse with stress. So the flares of back pain come with stress and with maybe anxiety or stress from work, as well as physical stress as well. What is your finding on this?
The kind of cases that, the back pain can be divided into functional, where there is a spasmodic spasms of the muscles, and there could be structural issues, that age related degeneration which happens, or because of some faulty posture or lifting something, you will have either a disc bulge or a disc prolapse or a prolapsed intervertebral disc. So there are variety of conditions which are, possible when we are dealing with back pain. And we all know that stress is one of the common or the most important aspects which can either contribute to the existing condition, or it can trigger the problem, or it can, kind of precipitate the inherent weakness that a person is carrying, which all of us carry because of whatever genetic inheritance that we have. And that is where homeopathy kind of ties in, because in modern medicine, we have seen that patients, the only option is that to take painkillers. And if the stress is something which is causing that, then painkillers are not going to address the stress. Whereas homeopathic medicines, given the nature of their holistic treatment, has a good scope to not only help the pain but also to ease the stress. Most of the times, you will see in the history that there is a history of grief, or there is a history of betrayal or deceived friendship, or some arguments that have happened, and after few weeks of that, the symptoms have started. Now these kind of things, modern medicine doctors are not trained, basically, that okay, this can lead to this. What they are trained is, okay, you have a back pain, you get a CT scan done, okay, now this is the reason for your back pain. But who knows that whatever has happened with the patient prior to the onset of this might have triggered the problem. So that is why I feel in such cases homeopathy works wonders.
So, what you're saying is that because homeopathy is holistic, it is automatically addressing those emotional stresses, and therefore, then it helps the body solve the muscular skeletal swellings and problems.
Correct. So I like to explain what I understand about homeopathy as to how it works. Principally, we have been taught that our body have an inherent potential to heal. For
Uh-huh.
example, if we get a cut and if we don't do anything, the body is going to heal the scar. Now, how does this happen even without medicine? Because there is something within the body which we as homeopaths call as the vital force. Now, that vital force is responsible for healing. Now, when does the disease happen? The disease happens when the vital force falls short of that healing mechanism. And when the vital force falls short of that healing mechanism, the body is throwing some signs and symptoms to us. Now, these signs and symptoms are the manifestations of the vital force itself. It only means, or it says that these are the symptoms through which the body is trying to heal, but it is incapable. And that is where homeopathy comes in. It tries to see the symptoms of the patient and match that with the symptoms in the remedy. And the remedy acts on the vital force, and that vital force is kind of stimulated. And it doubly energizes the vital force which is falling short. And that's how the healing happens. This is how I understand as homeopathy works.
Okay, so what you're saying is that the homeopathic remedy doesn't treat the back pain, it treats the vital force of the patient, which then stimulates the patient's own self-healing mechanism to correct that imbalance.
Exactly, exactly.
Okay, so now can you explain how how the right remedy is found? How do you know that that remedy is going to address that vital force in the right way?
Okay, so first of all, we understand the basic principle of homeopathy, which is the law of similars. What does it mean? That any remedy which is available in homeopathy, whenever it is given to any apparently healthy human beings, it has a potential to produce a series of symptoms. So, a substance which has been potentized has a potential to create some disturbance within the body. Now, how a homeopathic remedy is chosen is, for example, let's take that if there is a honeybee and there is a sting that the honeybee does. Now, because of that sting, there is a series of reactions that are produced. There is swelling, there is redness, there is pain, and there is heat, and it gets better by cold application. Now, the poison of the honeybee has a potential to produce these symptoms. Now, suppose a patient who has, let's say, for example, allergic urticarial rashes, which have exactly the similar manifestations as that of an honeybee, where the rashes are red, there is swelling, and there is heat, and the patient says that I feel better by cold. Now, these symptoms of the disease are exactly matching to those which are produced by the honeybee. So, a homeopath kind of what he does symptom matching. Now, this is what law of similars is. But we have to extend this, not only limit ourselves to the physical part, we have to extend this at the holistic level. Holistic level means we have to understand the mind of the patient. So when we say what we need to understand about the mind is we have to understand the circumstance in which he is living, the fears that the patient is having, the dreams that he is seeing, the stressful situations that the patient has gone through, and how has he perceived those situations and how he has experienced those situations. So when we take into consideration the physical part, the mental part, then we come to form a pattern of symptoms. And that pattern is to be matched with something which is very similar in homeopathic medicines. And when you find that exact match, then you are able to find the right medicine, and it has a potential to create miracles. The only challenge is to find that right remedy.
The right remedy. So let's talk a little bit more then about how we find the right remedy and how it's important to collect up. You've mentioned the physical symptoms and how you're experiencing those physical symptoms, and you've mentioned the emotional symptoms. So what you're saying is we're going to put all of that together, and then we find the remedy that has got those peculiarities, if you like, all together in that one remedy. So obviously, a honeybee sting, we don't know what the emotion of that is. So can you explain to me how the materia medica has got the emotional sides? Where does that information come from?
Okay. So what basically the question, as I understand, is that how the homeopathic medicines are proved and how the materia medica is formed. This is how I understand the question is, correct?
Yes.
Okay. So let us take an example of honeybee itself, that if we want to prove honeybee, first of all, we undergo a process of potentization. That's a little complex procedure, difficult to explain here, but it undergoes some ultra dilutions of the crushed honeybees. And when you reach a certain level of dilution, let's say 30 C or 200 C, then that medicine is given to a series of provers, so X number of provers, 30, 40, 50, whatever the number that may be. Then the provers are given a diary to note what are the changes that have happened in them after they have started taking this particular medicine. And then there is a supervisor we call as a proving supervisor. So every week or every 10 days, whatever time frame is decided, the supervisor has the information about those provers, whatever they have written. And when this proving gets complete after 1 month or 2 months, then there is entire collection of the symptoms that the number of provers have kind of noted down in their drug proving diary. And those symptoms will range from, say, what has happened at the level of the head, in the eyes, in the nose, in the tongue, in the mouth, in the throat, and till the toes. Plus, they will also notice the changes that have happened in their desires and aversions, the thirst for water, the character of the stools or urine, the sweating pattern. Now, this is what we call as the physical generals. And thirdly, they will also observe what are the changes that have happened in their nature, in their temperament. So maybe some person would say that I'm feeling very sad. Some would say that I'm feeling very jealous. Some would say that I'm feeling very irritable, especially before menses. So all these changes at the level of the body, at the level of their general lifestyle, and at the level of their emotions, even dreams, are recorded. And all those records have been maintained very systematically in the last 200 years by our older masters. And that is how we are able to, kind of gauge the symptoms.
Okay, so just to clarify then, when we make a remedy, when we make a homeopathic remedy, we're going to, in order to test it, we're going to give it to people who are well, and we're going to give it enough, lots of times until they have changes in their own symptoms.
Correct.
So we're not testing it on animals. We're not going through huge testing procedures with lots of things. We're actually giving it to well people, and we're monitoring what happens. So, okay, so, and then all of that information is collected, and that is what produces our books, our materia medica books and our repertories. And that's the information. So what you're saying is that every remedy has been tested on well people for over 200 years, and our books are records of those cases. So can you explain to me now, if we give the remedy over and over again, we are likely to what we call prove the remedy. Can you explain to me how we know how we don't prove the remedy, how we just use that remedy to get better and not to go on and evoke those symptoms?
Okay, a very good question. And this generally happens, when people in India, we call them as lay homeopaths. Lay homeopaths mean, they have not have an professional training in homeopathy, but they have done some courses here and there, and they start giving the medicines. These kind of cases or these situations arise with this category of homeopathy. Usually, this happens when you tend to give a particular remedy very frequently, and there is no proper follow-up. What do I mean by this? For example, suppose you take a remedy, let's say calcarea carp, and you have given that to a patient who is having recurrent cold coughs and adenoids and all that. Now you give the remedy, the patient starts improving. The principle which is mentioned in the organon is that once the remedy starts showing its action, you have to stop the remedy. You don't have to repeat as long as the remedy is acting. When the remedy stops to act, and if the symptoms are still there, that is the time that you have to again repeat the remedy. For example, patient has come to us for recurrent cold and cough. We have thought that calcarea carb is the remedy. You start him on calcarea carb. After 3 months, the patient says now his symptoms are better. As a homeopath, what I do is I ask the patient, in your observation, are you seeing that there is a dip in the symptoms day by day, or you have plateaued, or again he is going back into the relapse? If the patient says that the cold is getting better day by day, then I should not be repeating the remedy because the remedy is still acting, his symptoms are getting better day by day. If the symptoms have plateaued, that means the patient says his cold is better, but now it is not improving further. Or the patient says, or the parent says, again he's falling sick like before. These are the incidences when it calls for a repetition of the remedy. If you keep giving calcarea carb unnecessarily, then there is a possibility that you might develop a proving of calcarea carb. In fact, in our literature, we have Dr. Herring, who proved a remedy lachesis. And even in spite of being a professionally trained homeopath, the symptom of constantly, sensation of feeling choked around the neck and inability to wear the tie remained because he had proved lachesis. So you have to be careful. Even though the remedies don't have side effects, doesn't mean that you keep on taking it every.
Okay, so just to clarify again, then, what we're saying is that unlike normal mainstream medicine, where you might be given a remedy and you say you have to finish the all of the tablets that you've been given, homeopathy is not like that. Homeopathy, you give it and then you wait and you see how the symptom changes, and you only take it if you need to take it again. You don't keep taking it whether the symptoms have gone or not. That is not how you use homeopathy.
Yes. So if I have to give you an analogy that you're trying to move a car,
Okay.
okay? Now you are accelerating the car. Once the car has gained the momentum, there is no need to keep on pushing from behind because the car is moving.
Okay.
When the car comes to a standstill, then maybe again you push it. But if the car is moving and you push, there is chance that it will go out of control and you will meet with an accident. That is something what I feel is
That
with
is
repetition.
a really good way of explaining it. Thank you so much. And so that explains how homeopathy is given differently to mainstream medicine. So let's go back now to musculoskeletal diseases, because some of these, like rheumatoid arthritis, and they're structural and they're changed and they're really long standing and they develop over years. How can homeopathy help?
Well, if the patients are coming to us at a very early stage, then the chances of success are very high. Okay. If they come at a very late stage, then we can maximum give a good quality of life. I remember I had one patient who comes from a very averagely, earning middle class family and diagnosed with rheumatoid arthritis. This was how many? 7, 8, 9 years back. And he was advised one injection. I forget the name of that injection, but it was costing around 50,000 per injection, 50,000 Indian rupees.
Uh-huh.
And he was asked to take it, I think, every week or twice a month. And he said that this is difficult. I cannot afford. And which is a very practical thing. And
Yeah.
that is not the solution because it is not going to cure him as it is.
No.
And that is the time that his friend referred him to me. And that was 7, 8 years back. He is not only free from that injection, in fact, he does not have to take any other painkiller medicines or modern medicines like, HCQS or methotrexate, something like that. That is possible because he came to me at a very moderate stage. But the earlier they come, the better is the chance of success. And even if they come at the late stage, there is a possibility to keep them away from increasing doses of painkiller medicines.
Yes, and that's the vital thing, isn't it? Because obviously the more that you have, the less effective they are, and then you start getting the side effects of having so much. So what you're saying is that even if you still have the arthritis, it is so much better that you can enjoy life so much more by going through this stage. So it doesn't matter what stage you find homeopathy, because of course a lot of people say, I wish I had known about this earlier, but we can't go back in time, can we? We have to do what we can. So it is really, really interesting when we understand that homeopathy works in such a totally different way than mainstream medicine and painkillers, that often people can come to us when they have got medication and they are taking something in the mainstream. And homeopathy can still work as well as if they are still undergoing other treatments.
Absolutely, absolutely. In fact, all this is also given by our master Hahnemann in aphorism 91, if I'm not wrong, somewhere 88, 90 or 91. Where he mentions that you will come across cases where patients are on inhalers, are on painkillers, and it will mask the symptoms and how you have to deal in such cases. So it is not like if the patient is taking allopathy, now they cannot take homeopathy. Both the treatments to begin with can go side by side. In fact, I have had quite a few number of cases where patient is on hypothyroid medicines like L-troxin or Thyronorm,
Mhm.
but you keep giving the most indicated remedy. Then you ask them to investigate. If the thyroid level is normal, then use the thyroid medicine. Again, investigate every 2 months, 3 months, and gradually there are ways where you can free patients from modern medicines and eventually later on also from homeopathic medicine also. In fact, that's the biggest joy,
Yes.
that to see patients free from homeopathy and allopathy. That happens in very few percentage of cases, ideally speaking, because patients don't wait for that long. They start feeling better, they stop the treatment in between, and then again there are relapses. But if they stick, and then there is good potential to be free from medicines.
So it's really important for patients to be going to check with their doctors that they still need the medication as the homeopathy is taking effect and helping the body correct those imbalances.
Yes.
Fantastic. Thank you so much, Devang. It's been such a lovely opportunity just to explore a little deeper level about homeopathy. And I think you're going to have to come back and we'll go more into all of the other musculoskeletal areas because I took us off track slightly. So I do apologize for that, but I just couldn't resist having this opportunity of you explaining how homeopathy works and has been documented.
It is actually my pleasure. Even if we move away from musculoskeletal, it's important that people all around the world know that how it treats, what are the laws, and what are the medicines made up from, how a homeopath selects the medicine. All these are important things which I feel need to be reached to people all across. So whether it is a musculoskeletal disease, whether it is a mental disease,
Whatever.
skin disease, whatever disease it may be, the principle remains the same. You have to take a detailed case and try to find the right remedy.
Thank you. Thank you so much. I really enjoyed that session with Dr. Devang Shah. I do hope that you really got something out of it because it really was important to actually go into the depths of the philosophy of homeopathy so that we can understand more about what we're doing and how we're doing it. Now, next week, I'm going to be talking to Alice and we're going to be talking about reactions of homeopathic remedies. So whether that is a proving or whether that's a reaction or whether that's a healing modality or a sign of healing, we will be discussing every aspect of what might happen once you've taken a remedy. I look forward to seeing you there. I do hope you've enjoyed these episodes and I do hope you can subscribe to our channels. Now, there are various ways for you to listen to our podcast or watch it on video on YouTube. So whether it's iTunes, Spotify or YouTube, please do subscribe and please do leave us a review. If you leave us a review on these platforms, then more people will see our podcast. We just want more people to share the joy of homeopathy. It's a choice that everybody should know about. Please do everything you can to help us help more people.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.